Greetings, everybody. My name is Maxine Fuchsen, and I'm going to moderate our webinar today. And I just want to welcome everyone and thank you for taking time this afternoon to join us. And the webinar today, of course, is sponsored by the JVP Health Advisory Council, or the HAC, as we affectionately call ourselves. And it's great to see everybody here. And the title today is a report back from Jordan and the West Bank with a view on health. So a couple of housekeeping things that I'll say to just get started. If you notice that you have a way to get into the chat box, it should be on the bottom of your screen. It says chat, and so please feel free to write down your questions, comments, and I'll be monitoring that during the course of the webinar, and we'll have ample time in the second half for those questions to be asked and answered, hopefully. And yeah, so, and we'll see. I mean, we are a very few people. We have, thank you to Tali from JVP staff who's here doing technical assistance. And so it may be that we'll be able to unmute and have somewhat of a discussion. We'll sort of see how many people join in. Looks like there's about 11 of us now, so that's great. Let's see, we're gonna, the sort of format that we're gonna follow is we have 3 speakers. I'll introduce them in just a moment, and they're gonna do kind of 2 rounds. The first round is going to be very brief, and I'm going to be on the timer. And so each person will give a 3-minute reflection of some of the learnings, just the real essence of what they got from the trip. And then we'll go back around, and each person will have about 5 minutes to talk about a specific aspect of the trip, and I'll kind of outline that. So yeah, with that said, let's get started. And before we delve into tonight's webinar, this afternoon's webinar, for those of us on the West Coast, I just want to really give a plug to JVP HAC, a lot spurred on by Alice Rothschild. We have done a really, I think, robust series of webinars, and we have another one coming up on June 6th. That we hope you'll tune into. It looks really good. It's a web briefing hosted by, or our guest will be Dr. Syed Atshan. And it's Thursday, June 6th, 5 o'clock West Coast time, 8 o'clock East Coast time. You folks in the middle can figure it out. And Dr. Atshan is a Palestinian by heritage, professor at Swarthmore College. I've heard he's a really engaging speaker, and so it should be great. And the title of the webinar is Tel Aviv Nightclubs and West Bank Fabulous in the Holy Land. So great title. But for tonight, we're going to do a travel report back by other engaging speakers, 3 engaging speakers. And so, again, this sort of first round, I'll give the bios, and then the first few minutes will just be their high points and reflections on the trip. So we have S with us. S is a soon-to-complete master's in public health, and really glad to, and I should say all 3 of the speakers are active members of the JVP Health Advisory Council, and all are active, long-standing, phenomenal, fabulous people working for Palestine justice. We have also Sonia Detman, who is a social worker, mental health therapist, and comes from the Boston area. Alice Rothschild, who also comes from the Boston area, but now is claiming Seattle. And of course,
I just checked all of my connections. So far, they all appear to be.
So far.
Keep going.
Okay, sorry. Okay. So Alice is, of course, a physician and an author, and I'll put a plug in. She's written a really phenomenal series on this trip that you can find by going to Mondo Weiss, and various aspects of the trip are highlighted. So let's go ahead and get started. Sonia, do you want to just sort of start with your little 3-minute go around?
Sure. I was just going to give an overview of Jordan, which I think will be helpful, and as we go along, we'll fill in. So Jordan has a population of 10 million. It is a desert. and only 10% of its land is arable. It has scarce water resources. It has to import all its oil. And the Jordanian government recently signed an agreement with Israel to import natural gas through a pipeline that Jordan is largely paying for. Jordan is in the very beginning stages of building clean sources of energy. It's a poor country, largely. Its unemployment rate stands at 18.5%, which leads to some unrest, which we witnessed some of it with demonstrations that we saw. The country is in a very unstable region of the world. And this was brought home to me when we were driving north in Jordan to Mafraq, and we saw road turnoffs to both Syria and Iraq. But despite living in a very unstable part of the world, it appears to open its doors to refugees. No doubt this policy wouldn't be possible without the assistance of UNRWA and the UNHCR, but still Jordan stands out for its embrace of refugees. I don't know, Es, if you're going to talk more about Amman. Amman has a population of 4 million. That is, it has about 40% of the country's population. So I don't know. Do you want to chime in now, Es, with what you were going to say about Amman?
Yeah. I was actually going to talk more about the protest and resistance, the relationship right now that's currently going on with Zionism, particularly surrounding the natural gas protests. So let me see if I can get my screen sharing. So one of the kind of interesting things that happened while we were there is that our new friend Tamara Nassar, who is a writer for Electronic Intifada, who gave us a wonderful experience showing us both around Amman and also kind of giving us a better understanding of what was going on surrounding like the politics and relationship to Israel-Palestine right now, was kind of really brought to a head through this natural gas and the resistance to it that's currently happening. I think that what we got out of it was that there's a natural gas pipeline being put in for about $10 billion, which is, a good amount of money, but in context of the Jordanian national debt being about 40 million, it's become sort of this outrageous amount of money money going to a Texas-based company to bring in natural gas to a country that is ripe for sustainable energy, and at the same time buying that natural gas from Israel. It's sort of a very backroom deal type situation where even Parliament has not actually seen the final contract of what is being purchased and the amount of money that Jordan is giving to Israel and who exactly is benefiting from it. The pipeline goes from the northern Israel Syrian border, I believe, into Jordan through Mafraq, this area that's heavily changed recently through massive refugee immigration due to Syria and Iraq, that is now sort of becoming a very vulnerable spot in general. We managed to cross a protest that Tamara warned us or told us to come to at the Parliament, discussing the resistance to this bill, this legislation going through on the natural gas pipeline. It here was about, about 30, 40 people with a number of police and special service individuals kind of holding this down. It was supposed to be an open session, but ended up being closed off as a result. And through this pipeline, there's been this big pull towards reinvigorate what would essentially be BDS. There's a reason behind it. And there's also a response to it called Et Harak, which is basically saying that BDS does not go far enough in Jordan, that, you know, because they are so close to Israel, not only should there be boycotts of individual of structures, but also Israeli individuals too. There's no reason why Palestinians cannot speak for themselves. You know, and the protest did not have any official affiliation. This person here was an older man shouting poetry in support of the protest. This was sort of the sign of what they were. You know, there's signs with this being handed out. There are stickers and posters, which essentially translate to, if I'm understanding correctly, the gas of our enemy is occupation. And it just sort of, that whole situation of seeing that very much summed up what it felt like the political situation in Jordan was while we were there, where there's a lot of tension between resistance to Israel and supporting of Palestine, but at the same time, not, you know, a sort of a changing culture that's currently happening. And Alice, if you'd like to talk about
Sure. Refugees.
Yes.
So for me, the most sort of amazing learning curve that we were on was understanding the refugee situation. So I should start sharing my screen. Okay. So just for clarity here, just so you know, UNRWA stands for the United Nations Relief and Works Agency, and that's the organization that's solely responsible for Palestinian refugees. Then UNHCR, the United Nations High Commissioner for Refugees, is responsible for all the other refugees. And sort of a little bit of background on Jordan, which by the way is a kingdom. About 60% of its population are refugees, and in fact it has the second highest share of refugees compared to its population in the world, only surpassed by Lebanon. And the population of refugees has doubled since 2010. So you can just imagine what that's done in terms of the economy and who's living there. Now, the biggest refugee group, and this is going to get confusing, so listen carefully, there are 2.2 million Palestinians registered as refugees with UNRWA in Jordan. Now, the majority of them arrived in 1948 and from anywhere in historic Palestine. And then there was a second wave in 1967. And most of these folks have full citizenship. They're included in the social and economic life. So here's a scene from Amman, Jordan. People walking down the street, they could be Palestinian, they could be Jordanian. You can't tell. They're all part of the general economy. Now, there is an exception to this rule, which is the Gazans who arrived in 1967. So the Gazans, 158,000 Gazans arrived in 1967. And although UNRWA recognizes them as refugees, Jordan recognizes them as displaced persons. Now, the reason this is important is it means that they lack legal status, they can't get state services, you know, they can't get a driver's license. It really completely screws them. What they can get is a temporary residence passport every 2 years, but that's expensive and many of them can't afford it, so they have undocumented status. So basically, these folks are called ex-Gazans, again, for reasons not clear to me, and they're treated like foreign workers and they work in the lowest levels of work. And the most vulnerable of these extremely vulnerable people, 30,000 of them, live in UNRWA camps. So this is a picture of an UNRWA clinic in North Amman for Palestinians who do have status and citizenship, and it's a pretty functional camp. This is a picture from Jerash camp, which is the ex-Gazan camp, and it's just incredibly poor and dysfunctional. The thing that makes it even more crazy is that since 1988, the Jordanian government has been sort of arbitrarily and without notice withdrawing Jordanian nationality from Palestinians, and they don't know it until they go to get their services and they find out they've lost their citizenship. On top of that, there are Palestinians who in 48 and 67 fled to Iraq and Kuwait, and then when things got bad in Iraq and Kuwait, they fled to Jordan. From what I can tell, I think they get Jordanian nationality, but they are one of the highest groups at risk for losing that nationality, especially people from Kuwait. Now, the next wave of refugees are those from Iraq, and they're approximately...
I'm gonna just give you a little...
1 minute?
Minute.
Yeah. Okay. So there are about 1 million Iraqi refugees. They're registered 31,000 with UNHCR. There were 2 waves. First of all, they're classified as guests, so no benefits. There was the 2003 wave with the US invasion, who were more well-to-do, and then the 2014 wave, which was from ISIS-controlled areas, and they are really poor and had a huge bunch of kids from a project working with Iraqi refugees. And they're mostly seeking asylum in Australia, Canada, and Sweden. And then the last wave is the Syrians. There are over 670,000 Syrians. They are also not able to obtain citizenship. They're hugely poor and desperate. 17% live in camps. We mentioned the Mafraq refugee camp. It's the biggest camp in the world. This is a picture of it. And then there are 40 other refugee groups, Libyan, Somalian, Sudan, Yemen, et cetera, et cetera, et cetera. So it is a very interesting country in terms of refugee groups.
Great.
And I'm going to stop sharing.
Okay. So that, again, was just meant to be sort of little capsule overviews. One question that Alan asked, I think, as this relates back to your slide, was there was a sign in terms of, I think, referring back to the protest. Was there an organization?
No, there was not really any organizational focus happening. I mean, it's essentially like a mix of the BDS movement there, and then Et Harak, and then general organizing and protesting against this pipeline, which is sort of a unanimous. I mean, as far as I understood, unless Alice and Sonia, you heard otherwise, everyone was against. There was sort of unanimous, like, why are we doing this? It's a waste of, ranging from this is a waste of our money to why on earth are we giving money to the Zionists? The occupying force, I think, is the terminology used.
Occupying entity.
There we are.
Okay, so what we're going to do now is each of the speakers will have 5 minutes, and what they've decided to do is sort of break down the parts of the various parts of the trip. So Sonia's going to begin by speaking about the Jerash camp that Alice just mentioned, which is in Jordan. And then we'll go to S, who's going to talk specifically about the Lancet Palestine Health Alliance Conference, which the three folks attended. And then to Alice, who's going to speak about work specifically in Aida camp, in the refugee camp on the West Bank. Okay?
Okay.
And again, just before you start, Sonia, I'll remind folks, if there's any questions, please be sure to put them in the chat box so we have time to talk about them. Sonia.
Okay, I'm going to talk primarily about Jerash, one of 2 refugee camps that we visited in Jordan. The other was Nusa, which was a Palestinian camp. Jordan has, as you've already heard, a dizzying array of rules governing services and rights of different groups and nationalities of refugees. Jerash camp in northern Jordan is home to, Alice, I'm not sure, it may be 30,000 Gazans?
No, it's 158,000. Oh yeah, 30,000 Gazans, yes.
Gazans, yeah.
Right.
Or by ex-Gazans, as they are referred to in Jordan. This language already sets them apart from other Palestinian refugees. Gazans are further broken down into those who came before 1967 and those who came after 1967. Gazans who left the Gaza Strip pre-1967, when it was under Egyptian administrative control, became stateless when they left. Gazans who came to Jordan post-1967 are considered displaced persons. Neither group has Jordanian citizenship. In fact, Gazans are not classified as refugees by Jordan, as you already heard from Alice, but are classified as refugees by UNRWA and are thereby entitled to UNRWA services. Ex-Gazans are not granted a national ID number, but are granted a temporary passport that serves to document them as temporary residents in Jordan. In fact, Gazans, I lost my place. Ex-Gazans, okay, so they have this temporary document that has to be renewed every 2 years at a cost of $200. And failure to renew leads to the loss of a temporary document or passport. Ex-Gazans' status as temporary residents means that they cannot get government work, and the private sector is reluctant to hire them. They cannot vote or be represented in parliament. If a student all the odds and gets to university, he or she is charged as an international student and must pay tuition in dollars. In other words, to be Gazan, whether in the Gaza Strip or in Jordan, means a life of enduring hardship. We visited Jerash under the auspices of UNRWA. We traveled to the camp in a UN van, accompanied by some UN workers. As we entered the camp, groups of men were standing around, and I imagined that they were standing around waiting to see if someone would come and pick them up to do maybe some day work. We first visited the health center, and at first glance, the health center appeared worn and a bit disheveled. We met with one of 4 medical officers at the clinic, and he reported that each doctor sees 100+ patients in a 6-hour shift. This breaks down to a patient's FaceTime with a physician of 2 minutes and perhaps 5 to 7 minutes with a nurse. Healthcare delivery has improved, however, since the introduction of computerized files and a family team approach to healthcare delivery. Since Gazans are not eligible to enroll in government health plans, the costs of any referral outside the UNRWA system must be borne by the individual.
So yeah, I'll just give you a 1-minute time check here.
Okay. I came away from our visit at the health center thinking that however much people complain about UNRWA healthcare system, they are tackling a monumental job with inadequate resources. A walk to visit the girls' school, and on our way, the morning session of the boys' school was letting out. A group of boys were shouting and swearing at us and began throwing rocks. The only way I could make sense of it was to try to see it from their perspective. Here comes another group of privileged white people with notebooks in hand to view their lives, and when they leave, nothing has changed for them. Although there didn't seem to be a disparity in services that we saw between Nusa and the Camp for Palestinians and Jerash, I felt a sense of desperation in Jerash, a visible lack of resources. It may be because of lack of work opportunities outside the camp and an inevitable feeling of otherness. Jerash camp was the only place in Jordan I saw some women wearing burqas. Some adults apologized for the visible disrepair in the camp, saying that since the US cut funds, they are unable to even afford paint to spruce up the facilities.
I'm gonna have to
Okay. All right.
one final anything?
No, that's okay. That's fine.
Okay. S, do you want to continue about the Lancet Palestine Health Alliance conference?
Yeah, absolutely. Yeah, the general purpose of us going over there in the first place, the auspice of going was for the 10th annual LPHA Lancet Palestinian Health Alliance. And for those who are not fully aware of the Lancet, is a medical journal based out of Britain, started in 1823. It's, for academics, just the impact factor of something like 55.23, which is, for a journal, an academic journal, impact factors are usually on a 1 to 10 scale. So it's the second most impactful journal in the world in terms of medical literature. And LPHA in and of itself, which is a network based in the Lancet, is just a collection of Palestinian and international researchers working to build research capacity and research and advocacy as well for Palestinians in the occupied territory and globally. Mostly it's based around this conference that occurs once a year. Last year was in Beirut. This next upcoming year, if I'm not mistaken, it is at Birzeit University in Ramallah. And to date, the journal has accepted about 715 abstracts, most of them going on for publication. The structure of the organization is just sort of a loose network of individuals, and these things end up in an abstract journal that comes out once a year. So this year it was 2 days long, and it was a pretty fascinating experience, I think, for all of us. Topics, of course, ranged from political violence and checkpoints to things like nutrition and food security, but also a lot of talk about life satisfaction, mortality, morbidity related to cancer, and exposures. A good amount of information, a good amount of work on refugees, both from Syria and elsewhere, but primarily those coming from Syria into Lebanon. And a lot of work on maternal child health, specifically along the lines of domestic violence. And so the organization, originally Richard Horton, the chief editor of The Lancet, was supposed to open, but for whatever reason, he was not there. I believe this is the second year that he had to miss in the 10-year history of it. And so in his place was another member of The Lancet, another editor, I believe, reading things off. And so from there, I'd like to talk about three main themes that sort of came up, for me at least, while reflecting on this. And I think the first one is who was there. And plenty of representation from WHO, UNRWA, Beit University, American University of Beirut, and Al-Quds University, and a lot of the big names in the field of Palestine and health. Rita Giacomin, who was on the previous slide, Mads Gilbert, and Akiro Sieta from UNRWA. Were all there, and I think only Seta, and then at the very end, Giacomin were on panels, but for the most part, they weren't really the ones focused in on within the conference. They did not have the spotlight most of the time. And who was there was primarily, many of which were Palestinians, and particularly Palestinian women, and young Palestinian early career researchers, working on diverse topics, ranging from, on the top left, talking about B12 deficiency in both the West Bank and Gaza. On the right, if I'm not mistaken, it's proximity to the wall in the West Bank and proximity to the fence in Gaza, and the reflections this had on overall mental health and emotional deprivation. Second main theme, I would say, is who was not there. And not surprising to anyone, Gazans were fairly absent from this whole conversation. The panel that was one of the opening panels about Gaza. And it was pretty impactful to see that almost no one from Gaza was able to make it out. I think by the end of the conference, there was 2 individuals who ended up getting there in time, but this whole panel was not able to get there. And in their space, other researchers from the international setting gave the talks that were supposed to be happening here. This also affected the poster presentations, where throughout we would see, as poster presentations would happen, we would see this sign. And it came to the point, I would say probably about a third of the posters were presenter could not attend because they could not get out of Gaza. And keep in mind, this was also,
I'm just gonna interrupt and just say about 30 more seconds.
Great, wonderful. There's also not many NGOs and nonprofits or activists, organizations outside of academia, or the people actually being researched on health workers who were actually were present to be speaking for themselves. And I think the last major theme to talk about, and I'll just go through this very quickly, is just what was discussed. And a lot of, in terms of being a kind of an academic nerd myself, like it was a lot of just descriptive research being done, things on the violence and injuries from Great March of Return, and prevalence of domestic violence. But also there was a couple of very interesting things discussing the challenges coming from UNRWA, and particularly deprivation again. And I don't know if I actually have the slide of it. Oh, that's one of the dinner at the end. What I was trying to find is a slide on the budget shortfall in UNRWA that Seta talked about, where at the beginning of 2018 year, they, due to the U.S. and UN budget cuts, $538 million shortfall than budget they had planned for, and they ended up cutting about, I think, 92 million in austerity measures to make things work. And by the end, they ended up coming out with a zero, where they were able to fund every project that UNRWA had anticipated, but this next year sounds like it will be harder to come up with those funds. And so the sort of message of the conference was things are moving, and it's not entirely sure where things are moving towards.
Thanks, S. And we're going to move on now to the West Bank. And there's so much more. We'll come back, but let's leave time. So Alice.
Okay. So I'm going to talk about the work that we did. We were in Ida camp. And just for a little background, Palestinians in the occupied territories have a very challenging and chaotic healthcare system. They get care from the Ministry of Health, from UNRWA, from private sector, from NGOs. These guys don't talk to each other. Then they're drug reps. They can get a script without, a drug without a prescription. It's just a big chaotic mess. And then there are accessibility issues and financial challenges. And then, as you've heard, the average visit for an UNRWA doctor is 4 minutes. And that includes psychiatric in the whole thing. So at the Ida camp, there are several centers, and one of the centers is the Laji Center. And with funding from a group called 143, which is 1FOR43, they have created a program called Health for Palestine. And this is trying to address some of the issues of chaos and also lack of patient compliance, because the patients get so much differing advice. So they've trained a group of community health workers and identified the patients in the camp who are at high risk for diabetes and hypertension. And this cohort then gets home visits with the guidance of a physician who happens to be from Harvard. And through building a relationship with these patients, they are able to improve their health care. So we actually went on a number of these home visits, and I'll just give you a little example. This was a 77-year-old woman. She's in a tiny little room, in a living room, with her elderly husband, her 38-year-old daughter, her 2 grandchildren. The kid is coughing, everybody's talking, they're trying to feed us. And in the middle of all of this mess of relationship and laughing and warmth, she gets her glucose checked, she gets her hemoglobin 1A1C checked, she gets her blood pressure checked. There's a big discussion about her insulin, her sugars are out of control, they have a discussion about how to fix it, and she gets to decide which of the choices she wants to make. And meanwhile, the granddaughter says, well, what about her diet? And then they get into a whole discussion of diet. So it was clear that the relationships were critical to her compliance and her understanding. And another home, we saw a 59-year-old woman who had just been hospitalized for rapid pulse and chest pressure. And she basically pulled out a huge plastic bag and dumped her hospital records, all paper records, on the floor. And it was clear that when the doctor went through it, she'd actually gotten very good care, but she had no understanding of what happened. So he decoded it and he explained it, and then he went through her meds and he changed her blood pressure meds. And this is all while she's trying to give us lunch. And it's a very hands-on, positive way to deal with patients, and their outcomes are very good because of the relationships they build. And they also have apps, and they collect all the data and that kind of stuff. So it's a very impressive program, and really, I think, more about what healthcare is actually about. Now, I decided I would do an educational session with the health workers, because they're just community folks. They know about what to look for with diabetes and hypertension, but they don't know anything about GYN. And I figured they're dealing with all these older women who are going to get uterine cancer and all sorts of GYN issues. So we had a session, and I listed all the common complaints, which caused everybody to blush and giggle and debate everything. And then, I went through the different things. And at one point I asked, how much do people know about this? Where do you get your information? Biology class, a home? And everybody started giggling. And then one woman said, we learn everything on the first day of marriage, which seemed a little late to me. So anyway, it was a very fun, interesting experience. And just to give you a sense of the questions, one of the questions was, can showering during your period cause breast cancer? The most interesting question I got, and it was the most painful question, was, in our political condition here, men in the prison get their sperm out illegally to get to the women. what is the best condition for the sperm to be in. So there is a whole system undercover of smuggling prison sperm out to impregnate their wives. And we had this very political, medical, fascinating discussion. They knew a lot more than I did because that's not usually how I collect sperm. But that's the kind of questions you get when you do this kind of education. And the last thing I'm going to talk about is that at Ida Camp, there's also a group called the Al-Rawad Cultural Center, which is a phenomenal group that works with children and theater and dance and yoga and all sorts of stuff. And I did a women's empowerment group with Sonia. Now, in the past, when I've done these groups, after the blushing and the giggling, we get into GYN issues and sex, and that's what the women want to talk about. But I think because it was a social worker, after we did a little, GYN and sex, we immediately moved on to their fears about their children. And they were talking about their kids who are anxious and hyperactive and angry. And Sonia probed and probed, and then they said, well, the children are angry because the IDF keeps coming in and shooting them and tear gassing them, which seems a good reason to be angry. And then it turned out that a week earlier, one of the medics from another camp in Bethlehem called the Haisha camp had been killed. And then our translator started crying. And then, the level of pain and anguish and trauma was just right on the surface. So that made it possible for Sonia to talk about the need for groups, for people to talk about their trauma and how the children need to be able to not just accumulate all this stuff, but to be able to talk about it and support each other. And one of the sort of very, yeah, I know. One of the symbolic and painful things was that this 143 organization had a program to take the only space left in Ida Camp, which didn't have a building on it. It was just dirt. And it floods in the winter and is like desert in the summer. So they dug it out, they put a big cistern in it, it collects water in the winter, and then in the summer, the water is available. And on top of that, they built a sports field, and they built a beautiful playground. So this was for the children to have a place to play, because in Ida, children don't have a safe place to play. And so what's happened is that they put netting over the soccer field, and the kids were playing soccer, and it turns out that the IDF soldiers have been shooting at the kids and dropping tear gas on them. So the netting is all shredded now, and we went and saw that. And so the kids, their one safe, beautiful space isn't even safe. And that kind of symbolized for me what it is like to be a child in Ida Camp, and the fact that there is actually no limit to suffering here. And in fact, Ida Camp is the most tear-gassed little place in the world. And I think that that's a reality that we have to keep in mind. The end.
Thank you, everyone. So let me start by, I think there's like 14 of us. Let me start by, I'll just go over some of the questions that are on the screen in the chat box. And then maybe we will try to open it up. Hey, why not? And have a little discussion. We'll see how it goes. The first question, I think this goes to you, Sonia, or really anybody. You talked about the status of Gazans in Jordan. What are the consequences when ex-Gazans, whatever that means, fail to renew their temporary Jordanian passport?
I actually researched that if you don't know the answer.
I don't know a complete answer, but yeah.
Do you want me to answer it?
Yeah, go ahead.
Okay. So if they fail to renew it, but then they renew it quickly, they can get it. But if there's a delay, then they have to go through the whole security system to be eligible to get the passport. And it's 200 Jordanian dinars, not dollars, I think. But it's way beyond what most ex-Gazans can afford. So most of them actually don't get their passports because they can't afford it. And then they're, invisible to the system. They're stateless. They have no benefits from the state. It's pretty catastrophic. And it means that they work in agriculture, in sort of the lowest level jobs without protection and without anyone looking out for them because they're not recognized in the system. Is that what you think?
Yeah.
Uh-huh.
Yeah. What I understand, it's they risk being deported.
To where?
Back to Egypt.
Oh, Egypt. Oh, great.
Because technically they
Are
from
Egypt,
1948 they were given, they are within the control of Egypt.
But what if they came post 1967?
They are from Egypt if they're from Gaza.
It's a mess.
Yeah.
That's the answer.
Also, I think that the 48 Gazans get citizenship, but the 67 Gazans don't. What's your impression? That's your impression, yeah.
Yeah.
So I think There are two kinds of Gazans. The 40
Palestinians were accepted in 1948, but after 1948, they were either in Jordan, Lebanon, Egypt, or Syria in terms of the surrounding regions. And so from that point on, anyone in those regions as refugees are under the control of whatever nation time. And even though the borders changed, the understanding was they should have been in Egypt and not in Jordan.
These are the kinds of things we talked about every night until like 3 o'clock in the morning trying to figure it out.
Mm-hmm.
And still haven't figured out why people from Gaza are not called Palestinians from Gaza, but referred to as ex-Gazans. We could not get an answer to that.
And just to return, I just wanted to demonstrate a picture I have of what Alice was talking about with the tear gas canisters on top of netting, which is right here on this playground field. So.
Wow. And that's at
Ida.
At Ida, I mean, Ida.
Yeah.
Yeah. Wow.
It was a project of the 143.org.
Mm-hmm. A question to you, S. Do you know how many people attended? What was the audience size at the conference?
100? What do y'all think?
I think it was more than 100. I think it's like 400 or.
Yeah.
Oh.
I would say 300 or 400. Yeah.
Is it growing?
All right.
Is it growing in terms of numbers of people coming? Is it more accessible to?
Well, I know that the number of papers that are coming out are growing, so I would assume that the organization is growing. And also there are all these young women researchers, and they're all very eager to present and to be critiqued. And because the research skills in the de-developed places in the world are not fabulous, so they want the feedback and the critique and the debate about the statistical blah blah blahs that I don't understand, but Seth does, and so people are eager to come. So I think that it's growing.
And many of the people that I talked to and I got close with during the conference were there for the first time, and many of them were sort of the students of larger researchers who were there or not there. But for many of them, this was a piece of like, I want to be better involved in this, and I want to get my jump in. And this is one of the places where I know that like I can start jumping into this research field. I think it also is worth saying that whatever the number is that we said, there should have been another 100 or so ish individuals who were unable to attend due to the blockade of Gaza.
Mm-hmm. And the other thing is next year it's in Birzeit, and Birzeit University contributes a lot of people to this, so I would bet it'll be bigger, the people who can get to the West Bank. There'll be a bigger piece from Birzeit.
But potentially less individuals overall.
Right.
Mm-hmm.
I mean, one of the things they talked about in having an organization is they never can tell who's going to be able to show up, which is a hindrance to making a big scientific organization.
Absolutely.
And that's related to politics and not related to who wants to come.
Yeah. So what I'd like to do now, I think, Tali, help me if this is true. Can individuals just unmute themselves? Yes. So I think there's few enough of us. If you want to unmute yourself, if you start to speak, to ask your question and someone else is speaking, just be polite and wait. But I certainly have a couple more questions, but I'd love to open it up.
Peter, you're raising your hand.
Yeah, hi. I just got off an airplane. I was listening to the first half of this while I was sitting in the plane on the runway, and now I'm in the concourse in the airport. So I'm on my phone, but this has been fascinating, and thank you guys so much. I want to ask what the ability of Palestinians in all the various categories that you talked about, what possibility they have to enter the West Bank to visit family, for example. And then I also am curious about what limited possibilities are there, or what are their educational opportunities for you? What are the educational opportunities for young people who are refugees or in the various different status groups that you've talked about who are inside Jordan?
So you're asking if people who live in Jordan can get back to the West Bank?
That was the first question. The second
Okay.
question was about education.
Well, I think, okay. The Palestinians who live in Jordan, if they have a West Bank ID and they pass security clearance bridge, then I think they can get back to the West Bank. But if they don't have their West Bank ID, which many of them don't, or the Israelis have an issue with their security clearance, then they can't get back to the West Bank. Do I have that right?
That's my understanding, and 48 is off limits.
Yeah.
For the most part.
Right, I would
And
figure.
East Jerusalem is off limits, yeah.
Yeah.
And the second part of your question was what their
Education.
educational
Well, yeah, and that really, obviously hope is bleak right now, but education is one of the ways that there might be some opportunities to the degree that education is available. Even though it doesn't provide a financial resource, it's the opportunity to pursue something different in life than just hard labor.
So, it's a complex question, I think, even though it sounds simple. I mean, what I can speak to is what I have been told and what I know, and I don't know many of these things for certain. The things that we have been told on this trip, and I've been told on previous trips, are that within the West Bank, at least, it's one of the highest
educated, yeah.
The most educated population in the region in general, especially in secondary and further education. In Jordan, I believe it's significantly less even amongst Palestinians, though what I was told is that Palestinians tend to have more education on average than non-Palestinians within Jordan. One of the things we saw within the UNRWA schools was this kind of interesting conversation that was happening back and forth with the teachers there and the school administrators, saying that, our schools are not as, like, Jordanian public schools are terrible, our schools are a bit better, and we tend to do better than the public schools in general on all the standardized testing, which I don't think that says much from what we were also told. I know that it is not necessarily, there's not as many universities in Amman as there is in other major cities in Middle East and North Africa, but there is certainly some access. But I think significantly less than in the West Bank itself.
And also, I think that if people can get scholarships, that they can go to AUB in Beirut, and I think they can get education in Cairo. I don't know if they go to the Emirates, or I have no idea about that. But they would have to have scholarships. And I've heard that the Palestinian Authority will sometimes give scholarships, and there's some Palestinian organizations that will give scholarships. If they can get into the West Bank, there's Al-Quds and there's Bethlehem University and Al-Najjar, and there's some big universities in the West Bank, again, with different levels of scientific quality for science research.
Thanks.
So I can't see if hands are up. I don't know how you saw Peter's hands up, but that's great. But I do want to ask a question that, because I'd like to sort of maybe think about, how does the trip inform work ahead? Like, what can we as healthcare workers, Palestine justice activists, what kind of messages do you think, given the UNRWA defunding, given the considerations of changes in eliminating many people's refugee status, the administration's dismantling of what does it mean to be a refugee against international law, but how do you think that fits back with the learnings from the trip?
Well, I didn't have a lot of respect for UNRWA before I went. And although I know there are huge criticisms about UNRWA, I just feel like this organization is holding its own in an incredibly impossible situation. So of course, if you're a patient and you have a 2-minute visit, you're not going to be happy. But UNRWA has made several generations of Palestinians educated, treated their hypertension, their diabetes, made sure that they have a house to live in. I mean, things would be so much worse without UNRWA. And some people argue that, well, UNRWA is just making it possible for the Israeli occupation to continue because they sort of prop up the refugees and they prop up the countries that have the refugees in them. But I don't know that those countries would have kicked in. So I'm very worried if there is no UNRWA, what would happen to the refugees? I think it could be just catastrophic.
I agree. Yeah.
One of the things that was very striking to me that I have never gotten until this trip was Palestinians coming to me to us as Americans and saying, why does your country hate us? Like, why does your country hate us like this? And up until this point has been very much like, I've heard, like, yeah, America is, supports the Zionist entity and what have you, but not necessarily kind of that level of like, what is it about us that the US is so angry at and so hateful towards? And I feel like what I have taken away with us moving forward is that, I mean, I don't really understand that things are coming to a head and things are escalating very quickly throughout the world concerning Palestine. But I felt that there was a level of desperation there that I haven't seen before. And I think for us doing the work moving forward, being mindful of strategically what we can be doing to support things to build for Palestinians, led by Palestinians at home, that can be sustainable and resilient against whatever is coming next.
And also with attention to the fact of Palestinian refugees all over. I mean, I have a new understanding of that. They're never off the table. They should be in the leadership. Right?
Does the proposed changes around refugee status impact those refugees in Jordan?
What changes?
Which proposed changes?
As in from Trump and Kushner and, diminishing one's right to claim refugee status.
I don't think, if I remember correctly, it wasn't leaked when we were there. I think that got leaked after we had left. I think there was definitely tension surrounding that and what that means. And I think there was certainly a giant collective eye roll concerning the peace, whatever this peace plan at the century is, that people didn't even acknowledge it. And I think it speaks more to that people weren't even talking about the Israeli election. Like that was ignored. Even though that was
doesn't make any difference.
Yeah. And I think all these sorts of things, I think it just speaks to the fact that like all of this is essentially irrelevant to the lives of what Palestinian refugees are experiencing on a daily basis, and that they don't really, there's no reason to engage in a system that ignores them entirely. As is my what I got out of that.
Yeah, if you look at the blue and white party versus the Likud Netanyahu party, for a Palestinian, it doesn't make one iota of difference. And now that Netanyahu has to have a new election, who the hell knows what's going to go on? But it's not going to be good. And now they're saying that, the deal of the century ain't going to happen because, there's going to be an election and then Trump's going to want to get elected and blah, blah, blah. It's just like, it doesn't matter. It just catastrophe after catastrophe. But I also think you can't just poof make refugees go away as refugees. What exactly do they think are going to happen to them? It's just, it's magical thinking. It's magical thinking. And it's also dooming people to horrific levels of suffering. Because we saw what happened to the Syrian refugees who are not seen as refugees in Jordan, and the amount of suffering that they're going through, and they're a hugely traumatized population, is appalling. It's just appalling. They're not going to go away if you poof them into non-being refugees. It's crazy.
And also against international law. So
And immoral and a few other things, right?
Well, I'm looking at my clock and we have like 3 minutes left. So I think we're going to have to wrap it up. Does anybody have a short question that anyone who hasn't had a chance to ask?
I just want to thank everybody for doing this. It's very informative. Thanks for everybody for setting it up.
Absolutely.
Maybe we can have a
That's great.
contingent next year to go to Berzade.
I think that would be great.
Yeah.
Yeah, that'd be great. So let me tell you just in the parting minutes, a couple of things. Number one, the hosts of this webinar, of course, was the JVP HAC, or Health Advisory Council. So hopefully those of you who are listening in, who are participating, are part of the HAC. And if you're not and you'd like to be, then join us. There's lots of great things. And I think one of the feelings that I think all of my colleagues who are on the HAC feel like is that the health lens is such an important way of looking at human rights issues, really at the core of the issue of Palestine justice. So we hope from your voice as health workers in whatever way that intersects, consider joining the HAC and participating. You can participate through, as you hopefully know, we write a weekly human rights heroes and violations posting that goes up on our web page, which can be found as one of the councils on the JDP webpage. We do monthly HAC Media Watch, where we try to compile from various relevant journals all the issues in health related to Palestine justice. And Alice at this point is our compiler. We're really grateful, and we would love more people to be monitoring journals. So if you want to do that, I believe the best thing, of course, contact Alice. Is that right, Alice? Yeah, maybe you want to put your email.
The contact is on the website.
On the website. So yeah, so you can join by monitoring. We are just always interested in new ideas, and at some point have talked about maybe having a virtual meeting of the HAC in this kind of a format. So a way for people to put out their ideas, and certainly contact us through the info contact on the webpage and give us ideas that you have. Again, I want to push the next webinar, which is really soon. I think the announcement's going to go out this coming week, we hope. But Thursday, June 6th, mark your calendars, 5 o'clock West Coast time, 8 o'clock East Coast time. Tel Aviv nightclubs and West Bank checkpoints, the politics of being fabulous in the Holy Land. And that is going to be with Dr. Syed, who's
Achan.
From Swarthmore University, and it should be really, really engaging and great. Care workers supporting the House bill that Betty McCollum has introduced on Palestinian children, child detainees. There's just so many things, the UNRWA issue, as was brought up here, so many things that have huge health implications. And so I can't urge you enough to join on board. It's a great way to be involved in Palestine justice.
Fill out the survey.
Yes, and so post webinars, we always send out a survey because we really want to know your thoughts. How did it go? What did you like? Blah, blah, blah. So please fill it out, get it back. We go over it. We will talk about it and try to make any modifications. So I think it's our time. 1 minute after. I want to thank you to Sonia and Alice for presenting, and to all of you for taking the time to join in on the webinar today.
Thank you.
Thank you guys so much.
Thank you all.
Yeah.
Thank you.
Okay, bye.
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 Bye.